On the 5th of August, our permanent representative in Geneva, Dr. Ahmad Faisal, had written a letter to Gavi, the Global Alliance for Vaccine and Immunization, to express our interest in the Covax facility. And subsequently, Covax had a call with the Ministry of Health. There was concerns over the terms of the procurement, and that discussion has been ongoing. I've had 2 calls with Covax. My ministry has had another subsequent call with Covax. I'm aware of this sort of deadline tomorrow about
the payment.
Covax, but I think in my discussion with Covax, I think the policy of Covax is not notwithstanding the guideline tomorrow, is not to shut the door on any country. So we are still in the process of negotiation and discussion. We have some concerns. I've been discussing with the Ministry of Finance. I've been discussing with the Attorney General's chambers. I've been discussing with the Ministry of Health, directly with Tan Sri Hisham as well, about joining the Covax facility, presented to Prime Minister twice. It's something that we're still discussing with Covax.
Okay. So what are the concerns? You mentioned there were concerns. Is it finance, cost-wise, or what are we looking at?
Well, obviously that's one. I mean, the upfront payment is quite a big commitment. If you go for, there are two options to this, which is a compulsory purchase and the optional purchase. If you go for optional purchase, just as an illustration, if you go for optional purchase and decide to immunize 10% of your population, just the down payment alone is going to be about 90 million ringgit. That's just the down payment, yeah, and the cost of the vaccine itself. I think there's a if you go for compulsory, there's a ceiling of $20 per vaccine or per person per dose. So you're talking about quite a big commitment here. So obviously, price cost is an issue. We've seen pricing that's come out of pharmaceutical companies that are more competitive, for instance, than the price structure that has been proposed through Covax. So that's why we are still discussing, because we want to ensure that the agreement is not lopsided. There are countries that have joined, there are countries who have also not joined. We obviously want to still intend to join because this is also a bulk purchase, global solidarity, but the terms have to be fair to the countries who decide to join. Malaysia is categorized as a middle to high income country, not a low income country under Covax. So we don't receive any subsidy. We don't receive any assistance through the Covax facility. We're fully self-paying country. So that's part of Malaysia's challenge as well. So we are looking at Covax. We're looking at the price bilaterally with the pharmaceutical companies. We've signed non-disclosure agreements with many pharmaceutical companies, and we're seeing the price. We're seeing the data, the clinical trial data that will come through in the next couple of months. And then we can make a more informed decision. But even, let's say we go through Covax, Covax only allows you to take up to 50% of your population, not more than that. So even if we did go with Covax, their limit is only for each country to procure via Covax up to 50% of their population.
50 of 15, sorry.
50.
Okay.
50%. So that means that, for the remaining 50%, say you want herd immunity at about, 70, 80% or whatever it is, you still have to procure it outside of Covax. You still have to go directly. You still have to negotiate bilaterally with pharmaceutical companies. So I think it's important that we have multiple lines of negotiations right now. My assurance is that to the Malaysian public is that we are looking at this seriously. We don't want to be left out. Obviously, we want to make sure that once the vaccine is approved and available, that we'll be there and we'll get our initial allocation, at least for the most vulnerable groups that we can deploy the vaccine first. But at the same time, we want to ensure that any agreement is not lopsided, is fair, and the price is reasonable for procurement.
Realistically speaking, maybe you can just let us know, since you are in the know, what is Malaysia's chance or to get access to this vaccination? Because I think that's what people want to know, because although we are looking at various approaches, but I think in the end of the day, people want to know how soon can we get the vaccine. So what is your take on that?
I mean, it's difficult for me to give a commitment. This is all subject to so many things which are out of our control: regulatory approvals, and also transportation, logistics. But the assurance that I can give the Malaysian public is that we are pursuing a multi-pronged approach in trying to procure the COVID-19 vaccine, continuing to discuss via Covax, continuing to talk to governments directly like the Chinese government. I've just had a 1-hour discussion with the US ambassador about vaccines as well, talking directly with pharmaceutical companies through MOH, signing non-disclosure agreements, even looking at using fill-finish facilities here in Malaysia through some of our pharmaceutical companies, so buying the vaccine in bulk. I've been talking vaccine to vaccine people nonstop for the last month or so. In fact, last night, I even dreamt of being injected by the COVID vaccine. I even dreamt of the particular company that was injecting me. I'm not going to say which company it is, but yeah, I was injected there. Okay.
So it's vaccine talk all the way true, which is understandable because that is the debate that's everyone's mind. Okay,
so a matter of clarity, because this has come up a couple of times, and I just want to address this. It's some people ask, why is he talking about it? Why isn't
MOH? Yeah.
We have a working group between MOH, MOSTI, as well as Wisma Putra, Foreign Affairs Ministry. I work closely with Adham and Hisham on this, Dr. Sri Hishamuddin, as well as GG, as well as Dr. Tan Sri Jamila as well. We brief PM. It's just I'm coordinating this, and we work closely together. There's no issue of this ministry not doing anything, or what this ministry doing too much, or I think we're just trying to coordinate the response to this.
So you're the spokesperson for this committee, it's fair to say that?
For now, yeah.
Okay. Okay. All right. So, YB, what is your advice? Like, lots of people are very concerned, especially with the number of cases. It's, just increasing. I think that has caused another round of scare, to people here. So everybody is just worried about what's going to happen next. So okay. What do you want to tell the people?
I think the message is not just for today, but it's also for the medium term, because we don't know about the long-term efficacy of the vaccine. Whether or not the effectiveness of the vaccine continues for a long term. Whatever it is, we are going to have to practice public health measures for the foreseeable future. Just because we have the vaccine later, not knowing the seroconversion, not knowing how long it lasts, we will still have to practice the new normal, which is
measures, okay.
Distancing, masks, and things like that. I think obviously what's happened in the last 2 weeks is extremely unfortunate with a spike in the number of cases. We're working hard to bring the cases down and to flatten the curve again. And I think we can do it. Of course, everyone's worried because after being used to low 2-digit cases, suddenly we've got hundreds, and who isn't panicking? But don't. I mean, we have to trust our frontline professionals. We have to trust our security services doing contact tracing, trying to do enhanced MCO that is targeted in certain areas. We feel that the spread is still contained. Sabah, we've put in certain measures as announced by the Security Council. We're quite certain that most of the cases in Kedah, for instance, contained at a detention facility there. So yes, there is reason to be concerned, and I'm not downplaying that at all. And I think we should all be concerned, and we should all heighten our adherence to the SOPs. But at the same time, I don't think that we are at the precipice of a free fall here. I think that we are working hard to bring things under control. But again, tying it into the vaccine message is that even once we get the vaccine, not knowing its long-term efficacy, not knowing its long-term effectiveness, we really do need to live like this for some time until we develop antibodies that don't go away for corona, or unless somehow just corona peters out, like some of the earlier zoonotic diseases.
Yeah. Okay.